Let's begin our meeting today with our hearing from MyDigiRecords, founded by Dr. Saroj Gupta and her colleague Chris Humphreys. They'll take us through a presentation of the solution, and we are very eager to hear about how we can start looking forward to owning our own personal health records. So go ahead, please.
Very good. I'm going to start sharing the screen.
Okay.
Okay, there we go. Everybody see slides okay?
I'm seeing black right now.
Let's try again.
That looks good. Yes, that looks good.
Very good. I'll let you kick it off, Dr. Cooper.
So as you see, MyDigiRecords, everyone talks about EMR, and they usually focus on the provider, and we are focused on the consumer side. And the biggest problem is this, being a provider and not a technology person, and the provider, the biggest problem is this, they are not technologists, and there's a big gap. So being a provider, and I learned technology, I'm trying to fill that gap between provider and technologists. So that's the way we are building MyDigiRecords, to help the consumers to take control of their own record. And we will show you everything. Chris is going to walk on every single slide and to show you how what we are doing and what looks like that product looks like.
Yep. I'm going to start by sharing a video it's a video from the series Blue Bloods, but it illustrates some of the problem and challenges that many people face with their health records.
Right now we stabilized, but Michael's coronary arteries is 90% occluded. We'd like to do an angioplasty. That's where we blow a balloon in the artery, clear out the plaque. Your father's a relatively healthy man. He should do fine.
But there are risks.
He could blow a clot. There's a less than 10% chance, but a blood clot to the heart could be.
Don't I need to sign something for approval?
First, we need a list of all the prescription medications he's been taking.
I don't know.
It's important that we know that. Many in your father's stage are blood donors. It's always a concern between invasive procedures. His pharmacist would know all the medications.
So unfortunately, that is a common issue with if something happens and not being able to have your records and all at your fingertips when you need them, or if you are incapacitated, if you're not able to actually communicate to be able to share those records with family members. Right now, it is hard because there's no centralized system. Paper records that we've got through vaccine, the old paper vaccine records, they get lost, they get damaged, and frankly, you don't carry them around with you when you need them. I started to mention there's no centralized access for consumers. So most of the systems either don't talk to each other or your data is in different places, but there's no main central place where you can get your records on. Or you forget your information. If let's say you're guarding it, you're out guarding and you on a nail in the garden. First thing everybody asks, when was the last time you had a tetanus shot? And I know if you're anything like me, I have no idea, 3 years, 4 years, 5 years. So just having that information handy is extremely valuable. In fact, that lack of visibility contributes to the nearly $900 billion in medical waste each year, which is about the same as the annual defense budget for the US. And that number keeps going up. I think it is over $1 trillion now, but this is the latest we have actual source data on. Now, one of the things that you'll see in the data out there as well is that by empowering patients, we can actually reduce healthcare costs by up to 20%. Now, that is one of the holy grails. I know I've worked in healthcare for many, many years, and being able to empower patients is, while it can actually have this huge impact, it's incredibly difficult because there's multiple different aspects to being able to empower patients. But one of the big reasons one of the big ways to be able to empower patients is getting access to records. If you don't have access to your information, you can't make good healthcare decisions. Some of the other issues are price transparency and health literacy from an education standpoint. But one of the biggest things is just having that information readily available. And that's where MyDigiRecords comes in. So I'll show you a brief clip just to kind of highlight the solution, then we'll talk about some of the details in just a second. So what MyDigiRecords is focused on doing is putting that health information right at your fingertips. So we can help empower consumers to take control of their health with that information and ensure that it's always within reach 24/7, 365, because it's on your device. One thing that most everybody, one of the things we won't forget when we leave is our phone. So having that information right with you whenever you need it is incredibly important. Through the app, what we're talking about are actually tracking all of your records and aggregating those. But we'll also be able to push out guideline-based notifications and reminders which help families stay up to date with immunizations. So when you're coming up due for flu shot, MyDigiRecords will provide a notification and say, hey, it's time for your flu shot, make an appointment. Or if you've got kids and you're tracking kids, it's time for their shots for school, their booster shots or whatever. With the system, users can also easily manage their medications, both prescription and over-the-counter drugs, get information about those drugs, and then also receive notification about potential interactions. And one of the issues that we talk about a lot is, obviously we look to the pharmacists and doctors to be able to highlight those. However, a lot of us don't go to the same pharmacies. A lot of us use different pharmacies for different medications. One potential example that's very close to me, my stepfather, or my father-in-law, actually was a Vietnam veteran and gets part of his care through the VA, but also gets part of his care through private health insurance. So he uses different pharmacies, and he actually had a drug interaction with a couple medications that caused some heart issues in him, and they didn't catch it because it was two different pharmacists, two different pharmacies, and so they didn't know about it. If they've been tracking the medications in MyDigiRecords, they could have at least flagged it and said, hey, there's some documented drug interactions with these two medications. You need to talk to your doctor to find out more and if there's something you should do. And one of the important notes on this is we're not advocating for bypassing a doctor. It's actually to actually highlight information so that patients can actually ask their doctor and actually refer them back to their physicians. With the system, because we're pulling all the information together, it's system agnostics. There's no interoperability requirements. Pull all the information together, and leveraging blockchain and other technology will make sure we're HIPAA compliant and compliant with all regulations and cybersecurity protocols to make sure that we're protecting consumers' records. And entering information is extremely easy and flexible. Consumers have a lot of different ways to be able to enter their information. You can enter it through voice to text. So just by speaking into the information and have that information transcribed into the app in the certain fields. We'll be using automated record entry to import information directly from emails, office visit recaps, things like that. And that's worked if you ever travel very much and when you get the receipts in your email, all of a sudden a calendar entry pops up on your calendar and you just have to accept it. It's similar type of principle to be able to pull that information in automatically for you to confirm and import. It also leverages optical character recognition so that you can scan your prescription bottles or scan a paper prescription if you want, or any other medical records to be able to pull that information in. If you're going to enter it manually, we'll provide suggestions. So as you start to type, as in this example, like LIP, it'll actually put a suggestion like, are you trying to type in Lipitor? So to be able to use that to help ensure accuracy with the data. We'll also be looking at pulling in on the automated side, open APIs to pull in other records from different systems. So making it as easy as possible. For the customer side, so one of we're targeting larger groups rather than individual users. And the reason is to help get scale among larger populations faster. So being able to promote a healthier population and help mitigate the rising cost of care, helping families stay up to date with immunizations. There's a huge cost associated with vaccine preventable diseases. By getting getting groups of people on this on MyDigiRecords and having access to their records, we can help prevent over and underutilization of healthcare just from information, just having that information available. And could also be used to offset medical loss ratio rebates because it can actually apply to quality of life. And then on the flip side, it's great to get a large number of users to download and on the app. One of the big needs that we'll have is to drive user pull through because as we all know, we download so many apps, we need to make sure people are actually using the apps, make sure they're tracking their information because the information is not valuable if they're not using it. So one of the things that we'll work with customers to do is provide regular communication to encourage not only downloads to make sure that their groups are actually downloading the app, but also using it, tracking their information, tracking their immunizations and medications. We'll be using, leveraging those customer communication channels. It's like if we're working with a large insurance company, leverage their communication channels, providing content to be able to provide to users to ensure their groups are downloading and using the app. Same thing with employers, working with employer groups to be able to send their employees, make sure you're tracking your information, providing education on the features and benefits. And then if there are any incentives, some groups we've talked to have thought about the idea of providing discounts because of by leveraging this app because we can drive patient empowerment. We'll also use things that's not listed here, but geofencing. So if somebody walks into a CVS or a Walgreens, the app could pop up and say, hey, are you tracking medication? Are you tracking an immunization? So making sure that we're driving user pull through along the way. And that's it for us. So I'll open it up to any questions and the next format.
I'll get myself unmuted here. Thank you, Chris and Saroj. That's really great. Tell us a little bit about how you maybe are planning to go to market with this. So what sort of angles are you trying to get penetration? Yeah,
no, it's a good question. We're targeting large companies and groups. So for instance, we're targeting insurance companies to be able to offer this as another benefit for their members. Because if we can get insurance companies to drive usage among their patients, the goal would be to drive empowerment and hopefully reduce cost and claims to the system. The nice part about them too is on the insurance company side, because they'll have claims data on the back end, there is a potential for being able to connect the usage data and to claims and to be able to show ROI. So the goal would be if we show high numbers of usage of the app, and that hopefully would correlate to lower cost and lower amount of claims. We're also targeting large employers, especially self-insured employers, to offer as a benefit to pay for on behalf of their employees and members, because same reason, to be able to drive healthcare, to reduce healthcare costs for them, as well as other groups, non-for-profits. We see an opportunity with foster care and different groups like that. So rather than trying to target individual consumers, because the customer acquisition cost would be extremely high to get the 1 to 2, 3 people, it's really our go-to-market is about targeting large corporations and large groups on behalf of their employees, members, constituents.
And then we are talking to the states also.
Oh, yeah.
Directly collaborating with the states, especially on the Medicaid patient in the foster care. It's very, very important, especially in the foster care cares. It's really, really needed.
So in the example of the state, would it be that Medicaid would pay for this? Is that the idea?
Yes.
Yes.
Okay. Great. Other questions from the team? Daniel, did you have something?
Yeah, can you hear me?
Yes.
Yep.
Great presentation, really enjoyed it. I was wondering if the records that you are looking at, keeping on this central records depot, if there's any issues with digitizing them. A lot of insurance companies have issues with digital records so much that other companies have popped up in order to provide those as services, digitizing records, or if all of this is, if all of these types of records you're looking at don't have this issue.
We haven't come across that issue yet with any of the conversations, any of
No.
the potential customers we talked to, or any of those.
Yep.
That's good. John Birch.
Right. Hi, it was a very interesting presentation. I do have a question. I think you said something about that you are HIPAA compatible or HIPAA compliant.
Yes.
Why?
Because we are building everything on HL7.
I'm sorry.
HL7 is the one they use in healthcare.
So all the systems and platforms we're using with HL7 is HIPAA compliant. And the consumers own their records. So they have the choice of who to share information with, but they're keeping their own records. So they're pulling their own records, they're aggregating their own data. So that's not the issue.
So are you entering into business associate agreements with all the places that you get the data?
Yes, like Google, Amazon, MongoDB, we are using PBAs, yes.
Okay. Thanks.
And
I might have a similar question just about how, by the way, thank you for your presentation. How, as a user, I might get some of my historical data. So I'm envisioning, I have MyDigiRecords, and you talked about eventual APIs that would pull in data from other systems. I might have been to 8 or 9 different medical facilities over the past 10 years, let's say. How would I aggregate all of that historical data into my app?
So most of the data you're going to have is entering the data information you have today. So one of the things we're looking at the open APIs to any of those, any of your EMR systems that you have access to. I mean, one of these, obviously, there's a limitation to if you don't have your EMR access, then we can't, from an open API, we can't pull that data in if you don't have access to it. But because we're not going directly to all the different EMRs and health systems to be able to pull information on users, it's putting this in the hands of the consumer to be able to pull their data in. So what we'll do is pull the open APIs for them to be able to log into their chart and pull that data in from their own system, if that makes sense.
And then on top of it, another thing is this, let's say you have old records, which is very difficult for you to keep it. And we have a OCR technology with the help of app, you can bring all those things at one place. And another thing which we did not tell, another advantage of this app is people never ever, a lot of time they forget that they are taking any medication on the counter, and there are so many interactions on the prescription and on the counter medications. And with the help of this app, you guys can let your doctor know what other medications you are taking from the counter, because you are putting all the medications at one place.
now I understand that you had originally, particularly during the time of COVID, stressed the ability to capture vaccinations with this solution. Is that still considered a very fundamental part of your work?
Yes, immunization is the first one which we are rolling, yes. So it's based on CDC chart, all those stuff. That's our phase 1.
Any other questions from the team? Well, it's great to see such a solution arising in the Kansas City area. We thank you for sharing it with us, and we look forward to seeing your success as you move along, and hopefully you'll get a chance to, or we'll get a chance to catch up with you later and hear about some of your success stories.
Very good. And if there's any follow-up questions afterwards, you can feel free to reach out to either one of us as we move forward.
Great, thanks so much. Okay, I'd like to now turn to a solution that a Kansas City asset is helping to organize for telehealth. We have Luann Gonzalez from Advanced Physician Recruitment and her colleagues from MetTel, Chris Huxton, and from Zoom, Tyler Fiore. And I'll leave it up to you to guide us through what it is that you are bringing to the marketplace.
Great, thank you. I'll kick it off before I introduce Chase from MetTel and Tyler from Zoom. So I'm Luann Gonzalez, President of Advanced Physician Recruitment. I've been staffing physicians in Kansas City and surrounding areas for the past 25 years. My passion is underserved and under-resourced communities. I discovered even prior to COVID that there was a lack in adoption of telehealth in my rural hospitals and in some of my urban settings that lacked access to video quality broadband or lacked access to the funds to afford traditional complexity of telehealth. So I partnered with MetTel, who's a leading telecommunication company doing a lot of work in mobility, utilizing single SIM technology, and then partnered with Zoom as well to bring a simple mobile device that could be utilized anywhere, irregardless of broadband accessibility, and bring telehealth where we haven't been able to implement based on the obstacles of broadband or economic insecurity. So I feel like we've really created a dream team of partners. I'll let Chase talk about MetTel and their background and what they do, and then we'll have Tyler go over the software that we're putting on these tablets. So Chase, I'll hand it over to you.
Thank you so much, Luann. I'm going to share my screen because I just have a handful of short slides. So MetTel, and I really appreciate the time to present today. So MetTel is actually a nationwide wholesale carrier. We are headquartered in New York City, but we support over 5,000 customers today. And we also support many federal government agencies as well. As Luann mentioned, we're a mobile carrier. So that means we have underlying wholesale agreements with all of the major networks like AT&T, Verizon, T-Mobile. We do all of our staging and kitting in our warehouse. MetTel really owns the process from the device procurement standpoint. So what's unique about our solution, and it's really aimed at simplicity for the end user and ease of connectivity. We have a solution which is called the single SIM, and this is an IoT product, Internet of Things, but basically it is a SIM card that works on every network nationally, as well as more than 650 carriers worldwide. And if you put that SIM card into a tablet or any type of device, it will connect to the strongest signal. So in the rural areas, it will, in certain areas where there may be only one provider, the tablet will automatically connect to the strongest network in that area. We have the mobile device as a service model that we provide. allows the customer to really takes the complexity away from the customer. We handle everything on our back end. We stage and kit the devices. We handle the lifecycle management of the device itself. And when we ship it out to the provider or the end user, it will connect automatically and it's turnkey out of the box. And then if something breaks, we would then ship them a new device and put a return label for them to send the old device back. So, that's really the main, the basis of our solution. And we're doing this today, like I said, for a range of verticals, but it is really expanding in the healthcare space with mobile device telehealth. But we are doing this today for many federal agencies, like the Department of Defense, FEMA, Homeland Security, et cetera. So, it's a really, it's a great partnership that we have with Zoom, and that's really that is really the software that is going to be preloaded on the tablet. So I'll hand it over to Tyler, and then he can take you through what Zoom provides to the solution.
Hey, good morning, everyone. And thank you for the opportunity to speak with you guys. I'm Tyler Fiore. I'm a solutions engineer at Zoom. Thanks, Chase, for the introduction and the platform that you guys are providing. As you guys all know, Zoom is just the collaborative engine. So, the kitting and the distribution of the devices will be, performed by MyTel, but the application that we're running on those tablets will be Zoom behind the scenes, if you will. I had prepared a live demo for you guys. I came into the office because we opened up our offices, and now I realized that my iPad is not being able to log into the Wi-Fi, and IT is not around this early for me to help. But I did take some screenshots real quickly while everybody was talking, and hopefully I can provide some detailed or information on what that would look like. Basically, from the application standpoint, as kind of Chase alluded to, with that SIM card being able to, negotiate and recognize the strongest carrier that's available for those patients when they're joining into it. Zoom actually helps with that process as well. I don't know how well you guys have used Zoom from a mobile perspective, but we also handle bandwidth very effectively, as far as connectivity, network connection. We dynamically are reallocating bandwidth based on the network that is provided and as available. So if that network were to drop or be reduced, Zoom would dynamically reduce the quality of that video, meaning that if I started out at 720, I would reduce down to 460. I could go down to 360. If it got really bad, then we would reduce all the way down to audio only. As the network recovers, we would escalate that back to the appropriate bandwidth that it can recover to dynamically and in real time, meaning that the call would not drop. That's the idea. Can't guarantee all of that, but in most real worlds, dropping down to audio only will suffice, at least for connectivity and not requiring a patient to rejoin. The ability to do it on the tablet is really nice, because then you only have a single button to click, which is being managed by the platform itself. Let me just go ahead and share my screen just real quick, kind of show you what that looked like. Again, I was prepared to show a live demo of this. I do have a link that's not, that is generally the same principle of what I was going to show you here, but it's more, mine was more geared for healthcare. That's more for just generic purposes. So let me go ahead and share my screen. So here, I'm basically showing the interface that we go into for the Zoom application. So you log into your website, and I'll demonstrate this. Whoops, sorry. Dang. Sorry, my slide is going backwards. There we go. you would log into the Zoom portal and you would create a profile and a system for that connectivity. In this case, I've created a Zoom room and I've labeled it patient care. When I create that Zoom room, I put it in what we call kiosk mode. And when we do that, we have the ability to create several buttons that are here, that are represented here. We can change the background to be representative to what you would like in the back. We can also add a logo, and then we can designate the buttons and what action they require. In this case, I've just hit or keyed in a nurse's station or a primary care provider that can be called directly when the patient is launching the session. When they do that, this is a screenshot I took from my iPad. So basically when they are starting that iPad, they would be presented, and this is just representation for mine. MyTel will have a different representation for it, but the gist is the same. Basically, you'd have one button to press. So if I wanted to call the nurse's station, I could press that. It would ring a video person or a nurse at the nurse station where they would answer, and they would be in a Zoom call. I could call the doctor as well if that button was programmed. The idea here is that it's a single button to click to join into a video visit and get the appropriate individual to be on that session or in that call. That's kind of it. I would really want to show it live and show you what that looked like. Once they get into the video visit itself, it's a Zoom session. So any of the functionality that you're taking advantage today, breakout rooms, whiteboarding, private chat, all of that applies in the session itself. So it's no different. It's just the launching point in which the individual joins into that session with their provider. So I'm going to pause there and open it up for questions.
I thank you all very much for that. It's really very exciting to see the ability to connect from any network and the strongest one available. That's really an outstanding thing. And then the one-touch connection is very valuable, particularly for users who are not familiar with the solution. As you were saying, Luann, so many of your people were just sort of left out. It might be better to make it just that much simpler to be able to bring people in. I was wondering specifically about the SIM card, whether that is something that others could be using in their existing telehealth programs. Would that make sense, or does it have to be kitted in a device that MetTel sends out?
Are you asking, could the SIM card be put into an existing device?
Yes.
It could, but we would have to qualify that device. Typically, the device itself has to be unlocked. So if it's locked to a particular carrier like Verizon, let's just say,
Yes.
it's not gonna, it won't search for the next strongest signal. It would only be stuck on Verizon.
Right.
So in our scenario, we're going to be providing an unlocked device.
Okay. And it's preloaded with Zoom and ready to go really by the time the consumer receives it.
That's exactly right. So when we ship it, it's going to be preloaded and staged in that kiosk mode. And all they're going to see is that screen that Tyler showed where they can push the button to connect.
Okay. Very simple and straightforward from the consumer's perspective. Other questions from the group? Doug Hohulan, I'm going to put you on the spot.
Yeah, I appreciate the overview. I really like the kiosk mode. One thing we're struggling a little bit at KU School of Nursing with some of our projects is trying to, the learning curve to bring students up to speed on new technology.
1 miles, take a slight right turn onto Metcalf Avenue South.
Todd, I think you're, to bring the, how to have this immersive tech, where it's a one button click is just really, really important. So that's something I think that's going to be really helpful. And the other thing is just having, it comes preloaded and everything. That's sometimes very, I think that has a lot of value as well, because, you don't have to any pre-set up is really critical as well.
Right. And since it's a managed solution, we're not creating, we talk a lot about this, we're not creating a large project for the IT department. This is really something that we're going to handle, and we're going to work with the medical provider as to stage the solution as they need, but the actual handling of the devices themselves and all that is all going to be preset, and then they don't have to work with their IT departments.
Yeah, one other question I had is, in the past, like the FCC had $500 million for telemedicine projects that they were helping to fund. Do you see additional funding resources through the government or other agencies that are available for your solution?
Yeah, I'll answer that. We actually are working with the state of Missouri right now, and we're speaking to the House of Representatives tomorrow about a statewide project being funded by the governor in Missouri. So yeah, similar to that, we've got other states that have showed an interest in funding for just access in rural areas. So I think we've got, again, such a simplified solution. It can be shipped out, deployed within 30 days, fully kitted, branded. It's a one button push, simple use. What we're doing with Missouri is looking to put these in critical access emergency rooms where they may need addiction or mental health services, and they don't possess that in that particular community. So you're able to give the patient in the emergency room a tablet in a secure room where they've got privacy, and let them have that session with a mental health provider simply and quite affordably without having to use an expensive cart system. Because for a critical access hospital that may only have 10 behavioral health consults a month, the investment is much cheaper. We're everything included, all data, unlimited. We're under $200 a month per tablet. So it's a fraction of the cost of some traditional telehealth systems that may be overkill. And then we go back to connectivity. So yes, I do see funding still, and we're being brought into projects where they're trying to solve the inability to connect in rural areas and bring the services that they're lacking.
That's great. So your approach currently is through both the payer and the provider side of things. Is that correct?
Meaning what?
Well, in the case of the Missouri, would it be the state would be paying for the implementation? Is that correct? As opposed to individual provider?
We kind of, yeah, we're all over the board with different types of people that are looking at use cases. There's such a variety. So we've got actual critical access hospitals that are interested, fairly qualified health centers that are looking to use their own particular budget. We are working with HRSA grants. We're working with some of the different county governments. We're working with police departments, city governments, and then again, we've got state senators that have reached out, and then House of Representatives currently. So it's all the above.
Very good. Any other questions from the team? Well, we're coming to a rapid close here. Today we've got kind of a shortened version of our usual meeting, but this has been great. It's great to hear from both teams about the ability to really affect what happens for the consumer. That really is what drives things today, and we are very much appreciative of being able to see solutions that make that leap. So thank you all very much. And if there are no further announcements or thoughts, I'll close our meeting. Thanks to everyone for joining again today, and thanks for everyone who joined us at the 10th anniversary celebration last week or the week before last at the venue downtown, and we're very appreciative of your continued support. Bye now.
Thanks, everyone.